Hello, dear doctors. I hope that you are fine and everything is going okay with you. Welcome to our second session, our second free session in our online course, the course which has started one session ago. First of all, let's introduce myself again for all doctors who are joining us for the first time. I'm Dr. Ahmed Hisham, an OET expert who has been giving OET courses for about 6 years now, with thousands and thousands of success stories, alhamdulillah, across and among all professions: medicine, nursing, pharmacy, and physiotherapy. Okay, so for the doctors who are joining us for the first time, I just want to introduce to you our um, curriculum and our course just to have an idea about it before we start our session today, our writing session today, which is gonna be a recall-based letter, which is very important and appearing several times nowadays in the exam. So this course is with collaboration and under supervision of First Aid Mid Easy platform, of course, definitely the well-known one. In this course, we are going to cover all subtasks, including writing, speaking, listening, and reading, including live writing sessions, including workshops, which are completely recall based, including private writing assessment and private maybe workshops or speaking as well. We are giving speaking sessions, live speaking sessions, which are entirely based on the recalls only. Everything in this course will be according to the OET new trends. And for all doctors who haven't seen our first session, you can find it on First Aid Mid Easy platform after registration. All the sessions are completely recorded and will be uploaded to the platform, and you will have access to them for 6 months. Okay. As well, we are having or we are introducing listening and reading, and the listening and reading also will be based on the new trends. Okay, you will have access to the file of recalls, which you can guarantee for you, inshallah, about 24 out of 24 in part A listening. So it will be the main bulk to guarantee success in listening subtest. And in reading as well, you will be having orientation about how to tackle things and reading exactly, especially the challenging part of the reading, which is part C, and you will be having workshops as well. The most important part is the materials that you're gonna have access to them. There will be hundreds of materials in listening, reading, writing, and speaking, including 200 exams plus in listening, more than 100 exam in reading, more than 100 exam in writing, and 100 exam in speaking. The most important thing, you will have 25% discount off on our book of recalls, which will be announced very soon. Okay, this will be announced very soon, inshallah. And this book will be a game changer, literally a game changer in OET, because it will include all the new trends in the four subtests, which is happening for the first time in OET. Okay, this is very important. You will be having 24/7 support. You will be added to our private WhatsApp group, and till now, the doctors who have registered in the course have been added to our private WhatsApp group. So for all doctors who want to register, who want to start with us and continue with us the course, we will be having this session for free, and the next session will be on Thursday, next Thursday. Okay, the day after tomorrow, it will be also for free. And after that, who want to continue with us, he will need to register with Fame WhatsApp. Okay, and this is the number for the Fame admin, so you can contact them to avail the discount for the first 50 doctors who are going to be registered and involved in the course. Okay, this is regarding everything regarding our course. This is our schedule: the writing, the listening, reading, and speaking. 16 condensed session with all materials, with everything you need to pass the OET. Okay, so let's start now our our session today, the first writing session, which gonna be recall based. Okay, in the first or in the previous time, what we took was the types of letters that may be encountered in the exam in the OET. And now you are going to have the first type of letters, which is the routine referral. Again, for all doctors who haven't witnessed, who haven't watched the previous sessions, you can find the first session, which is an orientation webinar on Fame platform and on YouTube as well. And you can find the second session on Fame platform. You will be able to have access for it after a registration, and you can find it as well on our Google Drive. Both of them are available. Okay, so let's start now with the first type of letter, which is routine referral. Okay, this letter that you are seeing in front of you and that we will be discussing for some time is one of the recalls. Okay, it has appeared several times in February, so it's a very important one, and it's about routine referral to a dermatologist. Okay, so let's start. What do we mean by that and how to tackle the letter exactly? As we said in the previous session, we are having several types of letters, and from those letters, we are talking about the routine referral. In routine referral, we mean that we are having a patient who is having a specific complaint, and we are referring this patient to the dermatologist. Okay, or to a specialist, maybe to a dermatologist, to a rheumatologist, to a cardiologist, and so on. In this type of letter, we are having a patient who is going to be referred to a dermatologist. Why? Because this patient is having severe cystic acne. She is having severe acne and rosacea as well. So the patient is having acne and is having rosacea as well. How to tackle, doctors, the case notes, how to start writing. Let's see together that. Just give me a moment, please. Exactly one moment. Okay, let's go back and let's see the letter. Okay, so this letter is about routine referral. What are we having here? We are having this paper. Okay, we can see this is the first paper and this is the second one. This is exactly identical to what you will see in the exam. So you will be provided by two types of papers in the writing. Okay, we have talked that the writing will be the third subtest in the exam after listening and reading. So you will be having listening, reading, and writing. And in the writing, you should get grade B, which is equivalent to 350 to pass the writing, unless you are going through ESIF-MG certification or the USMLE pathway in the United States. And at this specific point, okay, um, you can also get C plus only to pass the writing subtest. Okay, so we are having this case notes, and then you will be having an empty file, maybe a Word file or stuff like that if you are going to have a computer-based exam. Okay, if you are going to have a paper-based exam, you will be provided by a booklet sample, and we will have a look at it as well. But you are having here a case notes, and you are having this empty file. This should be an empty file. So you should write a letter like this one to the specialist. And this is what we call a routine referral. Even in the urgent referral and in the discharge letter, you are going to refer the patient to another specialist. We will know that later. And you ought to transform the case notes into what? Into this shape of letter. So you will be writing this letter like that. So if we have a look at this letter, This is the start of the writing. Doctor, how to tackle the case notes, how to have a look at the case notes at the start of the exam. If we can see here, occupational English test, writing subtest, medicine. Why? Why medicine? Because we have agreed that each profession is different from the other in the writing and speaking. So all of you will have the same exam in listening and reading, whether you are nurse, doctor, whether you are a pharmacist or physiotherapist. However, the writing and the speaking subtest will be different. Okay? And this is an important part. Okay, if you can see here, doctor, you will find something which is reading time 5 minutes and writing time 40 minutes. What do we mean by that? What do we mean by reading time 5 minutes and writing time 40 minutes? Doctor, the writing subtest timing totally is 45 minutes. The writing subtest timing totally is 45 minutes. Does it mean that you will write the letter in 45 minutes? Of course, definitely no, doctor. This will never happen. You only have 40 minutes for the writing, 40 minutes for the writing, and 5 minutes for the reading. What do we mean by reading? You should read the whole case notes and start preparing it in 5 minutes without writing anything, without taking any notes, without holding your pencil, without writing anything on the keyboard. And after that, after the 5 minutes, then you will be able to start writing in the 40 minutes. You will be able to do that in the 40 minutes. However, in 5 minutes, you cannot do that. This is the first thing, doctor. Doctor, what will we do exactly in the 5 minutes? We will be discussing that in this session and the next session as well. Okay, we will tell you how to make benefit of the 5 minutes exactly in order not to waste your time and in order to be fully ready for the writing in the 40 minutes. Okay, so we have read this one. And after that, doctor, when you just receive the case notes, please don't start with the first paper. Doctor, sorry, we don't start with this one? Yes. Don't start reading this one or preparing this one. So what should I do exactly? You should go, doctor, to the second paper. The second paper in what we call the writing task. Okay, so in any type of letter, whether it's a routine referral, urgent referral, discharge, a transfer letter, you should always start with what? With the writing task, doctor. You should start with the writing task. And what should we do exactly with the writing task? In the writing task, doctor, you will know several things. First thing you will know what? You will know the type of the letter, which is here, refer the patient. Doctor, how will I know in the OET that this is a routine referral? You will see something like, write a routine referral or refer the patient or request assessment and management, for example. All of those, doctor, mean that this is a routine referral. Because if he wants you to write an urgent referral, he will tell you, write an urgent referral or refer the patient urgently. We have agreed that you are not the one doctor in the OET exam who determine whether this letter will be a routine referral or an urgent referral. He will provide you with such information. He will tell you, doctor, whether this is a routine referral or an urgent referral or a discharge or whatever. So in this letter, you will find refer the patient or write a routine referral. This is the first thing. So from the writing task, you knew what? You knew that this is a routine referral. Perfect. Okay, the second thing you will know, doctor, that you will know the specialty, okay? The specialty or the specialist to whom you are referring the patient to. Here you are referring the patient to a skin specialist or to a dermatologist. And this is very important. And it will have its unique benefit later on when we determine the information. So it's very important to know the type or the specialty to which you are referring the patient. After that, after that, doctor, you will know what? You will know why, why, why I'm referring the patient. And also you will know what do I need. So here, doctor, you will know two things. Why I'm referring the patient, why I'm referring the patient, because the patient is having severe acne and possible rosacea. So why I'm referring equals what? This, this thing, doctor, equals the diagnosis. So you will know the diagnosis, doctor, from the writing task. Why are you referring the patient? Because he is having severe acne and possible rosacea. Okay, so what do you need, doctor? You need assessment and management. You need what again, doctor, please? You need assessment and specialist management. So what do we call that? What do I need? What do we call it? We call it the purpose of the letter or the request in very simple words. Okay? So again, doctor, all of that have been known from the writing task. So from the writing task, I knew what? I knew the type of the letter, which is a routine referral. And I found the speciality as well. And this speciality gonna be very important in determining, in choosing the information that you need to write to the specialist. What else, doctor? You knew that the diagnosis that the patient is having severe acne and possible rosacea. And also, doctor, you knew what do you need or the purpose or the request, which is assessment and specialist management. And by that, you knew everything, doctor, that you need to write the letter. Doctor, what do you think that should be requested from any specialist in the world? Maybe something like assessment, maybe management, maybe diagnosis, maybe evaluation, okay? Something like that. Maybe something like surgical opinion, maybe a specific investigation, general investigations or specific investigation like MRI, maybe full blood count and stuff like that. Maybe something like follow up, right? Maybe ongoing care. That's it. What I'm doing now, doctors, I'm telling you what are you expecting to find as a purpose or request of the letter. What do you think, doctor, you are requesting from the specialist? It may be something like assessment, like management, like diagnosis, evaluation, opinion, like surgical opinion, investigations, follow up, ongoing care. Okay, so those things are the main purpose or the request. So in one case notes, you will find assessment and management. In another one, you will find evaluation and confirmed diagnosis. In another one, you will find investigations like MRI and so on. So that's we are expecting in any case note. Those are representing the purpose of the letter. Okay. Of course, definitely, doctors, you ought and you should write everything that we are saying now. You should have your own notebook. You should have maybe or writing or taking notes, maybe in your iPad or laptop or whatever, but please take notes for everything. This is the actual start of the writing and of our course. Okay? So this is regarding the writing task. I knew everything from here. Perfect. Doctor, do we know Or is it supposed that I will find all types of information in the writing task? No, doctor. Sometimes some of the information are written in the plan. Because in the plan, doctor, you will find also refer to dermatologist for management. Sometimes, doctor, not everything will be written in the writing task, but you will find the rest in what? In the plan. So in the plan, you will find the rest of what you need. Maybe the request, maybe the diagnosis, and so on. In some case notes, you don't find the word plan. Okay, so what do I find? You can find something like provisional diagnosis or preliminary diagnosis or even diagnosis only or confirmatory diagnosis. Maybe evaluation. That's it. So, not in all case notes, not in all types of letters, you will find the word plan. Okay? You will find in some case notes the word provisional diagnosis, preliminary diagnosis, diagnosis only, confirmatory diagnosis, evaluation, and so on. Doctor, is there a difference between the provisional diagnosis and the confirmatory diagnosis in the OET? Not to that extent, doctors. Not to that extent. It's not a big deal. Okay, it's not a big deal to focus whether the diagnosis is provisional or confirmatory or confirmed in the OET. There will be a small difference that we will talk about later on in the introduction, because in the confirmed diagnosis, you can say who has been diagnosed with such and such. But in the provisional, you can't say who has been diagnosed because it's not confirmed yet. So we will talk later on what should we say exactly if he tells me that this is a provisional diagnosis. However, it's not a big deal. They are exchangeable, by the way. It's fine. So don't be confused about this part. Whether he has given you plan, provisional, preliminary, diagnosis only, evaluation, confirmed or confirmatory, it's completely fine, doctor. Okay, this is the first thing that you need to tackle, doctor, in the case notes. Again, doctors, not to be confused. So I haven't started with the first paper. I just started with the second one, and then I went to the writing task. In the writing task, I determined and I knew the type of letter, the specialist, the request that I am in need of, maybe assessment and management or whatever, and what is the diagnosis of the patient. Acne and rosacea. Okay, if I have a look at the writing task, doctor, I will find something else, which is write the letter to Dr. Helena Vance, dermatologist, Skin Health Clinic, 45 Central Avenue, Newtown. What is that, doctor? This is the address. This is the specialist address. In another word, the recipient address. So this is the address to which you are writing this letter. Will I use that, doctor, later on? Yes, doctor. You will use that later on in this part. Okay, so let's remove that in this part, doctor. We will know all of that in details later on. Okay, so you will need to write the address of the specialist in the booklet sample or in the answer sheet, if we can call it so. So you will need to write Dr. Helena Vance, dermatologist, skin health clinic, and everything, because I need the address of the recipient to write the letter. This is very important. Okay, great. After that, doctor, after finishing the writing task and plan, we will go again to the first paper. Oh, okay. So, how did we start? We started with the writing task and the plan, right? Yes, perfect. And after that, doctor, we will go back to the first paper. And in the first paper, we are going to read and we will go through this session and the next one in the reading time, which is 5 minutes. What to do exactly, doctors, in the 5 minutes of reading time? You should select your information, doctor, in the 5 minutes. You should do what? You should select your information in the 5 minutes. Doctor, excuse me, what do you mean by choosing or selecting my information in the 5 minutes? Doctor, do you think that the OET writing subtest needs you to do copy and paste for the case notes into the file? Do you think that it is testing you, it's examining you to just do copy and paste in your answer sheet? It's not like that. Of course, definitely, doctor, it's not examining you or testing you to do that. It's not about doctor doing copy and paste in the answer sheet. So it's about what? Selecting the information, selecting the relevant data. Okay, so let's imagine, doctor, that you are a dermatologist and the patient is coming to you with a specific complaint. So you should be ready, doctor. You should be ready to listen only. You should want to listen only to what is relevant to the presenting complaint, what is relevant to the patient. So let's suppose, doctor, that you are a dermatologist and the patient is keeping telling you that, doctor, I got divorced, I'm having 3 children, and all of my children are going to the school and they are having lots of hobbies. So you will tell the patient, excuse me, why are you telling me all of that, doctor? Why are you saying all of that? I don't need that. Oh, so let's imagine that the case notes are exactly like a big file from which you should select specific information to deliver to the specialist. And from that, doctor, we do divide the types of information in the case notes to 3 categories according to the relevance. Either we are having relevant data or irrelevant data. So we are having here irrelevant data, relevant data, irrelevant data, and between them there is semi-relevant data. Doctor, what do we mean by that? What do we mean by relevant data, irrelevant, and semi-relevant? The relevant data, doctor, is the information that you must include in your answer sheet. The specialist must know that, doctor. The specialist must know the relevant data, must know the relevant information. So if we're gonna give a sign to this one, it will be like this one. And in the irrelevant, you shouldn't mention any piece of information of that to the specialist. And if you mentioned any, you will lose marks. And what about the semi-relevant data? What about the semi-relevant data? The semi-relevant, we can give it the sign of dash maybe. In the semi-relevant data or the semi-relevant information, you are confused. You are asking yourself, should I include this piece of information or not? If you are asking yourself this question, doctor, if you are suspecting whether to include it or not, it's a semi-relevant data. Again, doctor. So in the relevant data, those are the information that you must include in your case notes. And if you don't include the relevant data, you will lose marks because you have missed something important to the specialist. And the opposite is true. In the irrelevant data, if you include any of them to the specialist, you will lose marks as well. Why, doctor? Why you will lose marks? Because you have included something which is not needed by the specialist. He doesn't need to listen to that. He doesn't need to know that. And that's why it's irrelevant information or irrelevant data. In the semi-relevant, you are just in between both of categories. So you can include those information or you can exclude them. You can include them or you can exclude them. No one can say that this information is relevant and no one can say that it's irrelevant. Doctor, please give me an example. I don't understand that. As I told you, doctor, for example, if you are having what? If you are having a dermatologist. So for the relevant information or the relevant data, the patient will be presenting with a lesion, a skin lesion, right? All the details for the skin lesion will be what? Will be relevant information. Okay? And what will be the irrelevant? Maybe something like the social history. That the patient is married, has 3 children, they have hobbies, he has lots of work to do. All of this, doctor, is not relevant to the specialist. All of this is not relevant to the dermatologist. So he doesn't need to know that. In the semi-relevant part, in the semi-relevant, I've told you that the semi-relevant can be some information that can be included or you can leave them. It's fine. So what do they depend on, doctor? When to include the semi-relevant data and when not to write them? If you see something here, doctor, at the end, after the writing task, you will find these words. You will find these words. In your answer, expand the relevant notes into complete sentences. Don't use note form and use letter format. And the body of the letter should be 180 to 200 words. What does he mean by that? He is telling you, doctor, don't use the notes. Don't use note form. Okay? You will find here, doctor, some sentences. Those are not correct sentences grammatically. There is nothing called subjective, minimal improvement in acne, reports frequent facial flushing, moderate cystic. This is not a letter. This is not a correct sentence. So he is telling you don't use the note form because some of the doctors think that the letter will be written like an article in a newspaper or a magazine. It's not like that. The letter will be consisting of parts, as we see and we will be discussing later: address, date, salutation and regarding, and date of birth, introduction, body of the letter. Okay? And at the end you will find closure. So it's not a note form because some of the doctors think that they should be writing in all lines like sentences together like notes. This is not the exam. You should write a letter. Okay? That's what we are talking about. You should write a letter. So he is telling you that. Again, he is telling you, doctor, the body of the letter should be 180 to 200 words. What does he mean by that? Doctor, am I going to count the words, the number of words in the exam? The answer is definitely no, doctor. You will not count the words. You will not count the words in the exam. And by the way, doctors, it's not my opinion. This is written in the official OET website. What is written is we don't count the letter. We don't count the number of words in the letter. We don't do that. So why did he say to you the body should be 180 to 200 words? Because, doctor, he wants, arrange that all the candidates, that all the students should write around. I mean, for a letter, if it is supposed to be written, for example, in 200 words, and some of the candidates wrote it in 220 words, this is accepted. 240 words, it's accepted. But what if a candidate has written about 400 words? What if the candidate wrote 400 words. Is it accepted? No, doctor. Why, doctor? You told me that the number of words is not important. We don't count the number of words. Yes, but what does it mean that the letter should be written in 200 words and some candidate wrote it in 400 words? What does it mean, doctor? What does it indicate? It indicates that this candidate must have included information that shouldn't be included in the letter. And at this stage, doctors, he will be deducted marks. He will lose marks. Why? Because he must have included irrelevant data or irrelevant information that shouldn't be written. And by the way, the opposite is true. What if there is some letter which should be written in maybe 220 words? Okay? And some candidate came and wrote the whole letter in maybe 100 words only. Is that correct? No, doctor. Doctor, why will this candidate lose marks? Is it because the number of words? No. It's because that he must have missed some information that must be included in the letter. Because the letter is ought to be written in 220 words and he wrote only 100 words. What does it mean? He must have lost, he must have missed some words that or some information that must be written in the letter, which we call the relevant data or relevant information. And then he will lose marks only because he hasn't mentioned that. So what I want to say, doctors, it's about the relevance of the information, the relevance of data. I swear, doctors, what differs some or what differentiates some candidate from the other one is not the grammar. Because you will see later on that the grammar in the OET is very simple, very straightforward, very simple. Okay? The punctuation is simple. The spelling also can be controlled. But what differentiate one candidate from the other, or what differentiate doctors from one to other, is judgment of the information, is your clinical judgment. You are a doctor. You are a doctor, and that's why we are saying the writing profession is specific, or the writing subtest is specific to each profession. You are a doctor. You should include only what needs to be included to the specialist. Don't include every single thing, doctor, in the case notes. If you do that, you will never get grade B, doctor. He is not examining you. He is not testing you, doctor, to do copy and paste from the case notes to the answer sheet. It's not the exam. He is not examining you to do that. He wants to make sure that he can rely on you. He can depend on you to write a letter with only relevant information, without anything irrelevant that may distract the specialist. And have you noticed, doctor, that the meaning of relevance depends on what? The meaning of relevance depends on the speciality or the specialist. And that's why I've told you, doctors, that in the writing task, the speciality or the specialist is the most important thing. Because what is relevant to some specialist will be irrelevant to another one. The social history is not relevant to a dermatologist. However, it's completely relevant and must be included to whom? To the psychiatrist. So, in psychiatric referral, you must mention the social history. And you don't need to mention anything related to dermatology. And in dermatological referral, vice versa, the opposite is correct. I hope that you get this point. This is the core of writing. This is the core that makes one candidate gets 250 and the other candidate gets a 370, 380, even 400, because he knows what to write and to whom he is sending the letter. Okay, so what about, doctor, the semi-relevant? You are telling me that I should write maybe around a pool of words. So What about the semi-relevant? The semi-relevant, doctor, depends on what? The semi-relevant depends on the size of the letter. If you are having a very long case notes, a very long case notes, so in this letter, you should neglect not only the irrelevant information, but also the semi-relevant. By that I mean, for example, doctors, in this way, of course, we will be going through the whole case notes. Okay. However, I just want to tell you, in some specific visits, he is telling the dermatologist that the temperature 36.8, pulse is 72, and blood pressure is normal. Do I need to mention, do I need to mention every single thing related to the vital signs to the specialist? If the temperature is normal, it means that there's no infection. So you don't need to mention all of that to the dermatologist. So I can't say this piece of information is irrelevant, however, it can be semi-relevant. And that's why you can neglect it. It's fine. What I mean, you can neglect the semi-relevant information or you can include them. You will not get marks because of including them or their inclusion, and you will not be deducted marks or lose marks if you don't try them. Doctor, how will I know that this piece of information is um, semi-relevant? Doctor, if you just suspect, should I write this piece of information or not? This will be a semi-relevant because no one, literally, no one cannot agree or accept that this piece of information is relevant. For example, you are referring here because of acne. The patient is presenting with facial breakouts for 6 months. Can anyone disagree? Can anyone disagree that this piece of information is completely relevant to the dermatologist? Of course, it's relevant. Okay? So if all doctors agree after asking themselves, should I mention this piece of information? This is a relevant one. Other thing, can anyone disagree that the father is having a hypertension is a relevant piece of information? Should you mention to the dermatologist as the patient is having acne that the patient's father was having hypertension? What does he need to do with that? How this will help the specialist in treating acne or resistant to acne? You don't need to mention that. So this is an irrelevant piece of information. However, there might be some conflict between doctors among, for example, the medical history. The patient was having childhood eczema. The patient is having seasonal allergies or hay fever. So some of the doctors may say, well, I want to mention that to the dermatologist because those things are related to dermatology generally. So the consultant needs to know that. And some other doctors can say, oh, how will childhood eczema or hay fever help the specialist to treat the acne? Will this piece of information have a direct impact on treating acne or rosacea? Of course, no. They will not impact the treatment. They will not affect the consultant's decision to do specific treatment. So some of the doctors may say, yes, I will include this information because they are related to dermatology generally. So the dermatologists need to know that. And some other doctors gonna say, no, this will not affect the specialist management. This will not affect the specialist decision. So I will not try that. If this conflict happens, if this difference in opinion happens, then it's semi-relevant. You can write it or you can neglect it. Take it or leave it. You are the one who can determine, doctor. If you are having a very long letter and you feel that you are in short of time, you cannot write everything, okay, just leave it. If you think, doctor, that you want to write it and you want to include it, okay, it's fine. Please write it. It will not affect your grade, doctor. It will not affect your grade, whether to leave it or to write it. I hope, doctors, that this point is very clear to you. We have been a long time, I think, explaining this part, but believe me, this part, I swear, doctor, can make you get grade B or make you get grade C without passing the letter, or even C plus, and you want to get grade B for GMC registration, maybe. So, selecting the information is the core in the OET writing, doctor. Okay, let's continue something here. So, as we said previously, our main aim in the 5 minutes will be to select the relevant data, to exclude the irrelevant data, and the semi-relevant may be included or maybe not, it's fine. Doctor, excuse me, how will I do that in the 5 minutes of reading? You told me that I couldn't hold a pencil, I couldn't write anything, so what can I do? Yes, doctor, you will do that mentally. You will do that with your eyes, just that, in the 5 minutes. You will determine in your mind, yes, this piece of information is relevant, or no, this piece of information is irrelevant, or I can write this information or not, so it's semi-relevant. So when the 40 minutes start, doctor, you know exactly what to write and what to exclude. Then you can hold your pencil and just do the tick sign beside the relevant, or the wrong sign beside the irrelevant, or dash beside the semi-relevant. Doctor, I'm having a computer-based exam, not a paper one. In the computer-based, you cannot do these signs. We have agreed from day one, doctor, that there's difference between computer-based and paper-based. And throughout the sessions and throughout the course, we are going to explain clearly in details the difference between the computer and the paper in each subtest. Okay? In the paper, you can hold your pencil and do this sign beside the relevant, this sign beside the irrelevant, or dash beside the semi-relevant. But in the computer based, you can do that. So what shall I do? You can do highlighting, doctor. What do you mean by highlight, like I'm doing now? Like this one. You can do that, doctor, in the exam. So you will only highlight what? You will only highlight what is relevant. Don't highlight the irrelevant ones. And the semi-relevant, you can do highlighting for it or not. It's completely fine. Okay, I hope, doctor, this is clear. Let's take a small part in addition and then stop. So here we are having the name of the patient. Here we are having what? We are having the name of the patient. Doctor, is the name relevant? Of course, this is not a question. Literally, yes, the name is relevant. And what about the age, doctor? Sorry, what about the age? Or the date of birth? Yes, doctor, it's relevant. How? We will know later on, inshallah, that we're gonna include the patient's name. Okay, let's do it like that. We're gonna include the patient's name and the date of birth as well, and the age of the patient as well. Yes, we will do that. So I need the patient's name, I need the date of birth. What is DOB? DOB is date of birth. So we just take DOB, and that's date of birth. Okay, we will know that later on. So I need the patient's name and age. Doctor, what about the occupation? Do I need the occupation? Yes. We will know later on as well, doctor, that we can identify the patient in the introduction with what? With the occupation. So I'm saying here a 25-year-old primary school teacher. So a 25-year-old primary school teacher, I'm just identifying the patient with the occupation. So yes, I do need the occupation in the introduction. Perfect. Doctor, what about smoking and drinking? Doctor, please write a golden tip or a golden sentence now. Special habits are almost always relevant in all letters. Full stop. The special habits doctors are almost always relevant in all types of letters. So, smoking and drinking are relevant. They are irrelevant in very, very, very little or small number of letters. Maybe you are referring the patient to an occupational therapist, in which you don't need to mention that the patient is drinking or smoking. However, about 99% of the letters, you will need to mention smoking and drinking in it. Completely relevant. Perfect. In this type of letter, please write in the chat box. In this type of letter, what do you think about the hobbies? Please, doctor, share in the chat box. Do you think this piece of information is relevant or not? Write in the chat box, please, doctors. What do you think? What do you think, doctor, about it? What do you think about um, the hobbies here? Okay, we are having here conflict. Some saying relevant, some saying no, some saying relevant. Of course, definitely, doctors, of course, definitely, it's not relevant here. Doctor, the patient is having acne and rosacea. Do you think swimming and outdoor hiking is relevant to the acne and rosacea? Of course not. Doctor, but swimming and hiking can be related to some other disease. Yes, but not acne and rosacea. Maybe they are relevant to something like pityriasis versicolor, if anyone knows this disease. Yes, swimming can be related to pityriasis versicolor, which is hypopigmentation in some parts of the skin. But swimming and hiking are not relevant to the acne and rosacea. And that's what I'm saying, doctor. The relevance is not only to the specialist, however, it's important and related to the presenting complaint as well. So if the presenting complaint is about something related to the hobbies, I can mention it. And if it's not, I don't need to mention it. And that's why the acne and rosacea are not related to swimming or hiking. So no need to mention that to the dermatologist. Okay, this is great. What about the family history of adult acne in mother? Of course it's relevant. Of course, definitely. It means that he is having acne in his family. So you need to write this information. It's relevant. But the father is having hypertension. We have agreed that it's not relevant. Okay? What about the medical history here? What about the medical history here? I'm having childhood eczema. I'm having seasonal allergies or hay fever. As we have talked, some of you might include them as relevant data because some will say, I need to mention the previous disease related to dermatology to the dermatologist, and some may say, this will not affect the specialist treatment or management plan. I'm not going to mention that. So you can consider it as semi-relevant, so you can choose whether to include it or to neglect it. It's fine. Okay, this is important one. The last thing in today's sessions, doctor, before ending our session, I've told you that the smoking and drinking are relevant in about 99%, right? They are relevant nearly in all types of letters. And I've told you a while ago that the social history is a must in psychiatric referral. The social history is a must in psychiatric referral. So, in the psychiatric referral, you must mention what? The social history. It's very important. Okay, what about the allergies, doctor? What about the allergies? Should I mention the allergies in all types of letter or should I neglect it? Please focus, doctor, very well for only 5 minutes and that's it. In allergies, doctor, in allergies, the allergy can be relevant and at the same time it can be irrelevant and not mentioned. How, doctor? Doctor, if you are talking about a medical condition which is related to allergy or allergic reaction generally, or hypersensitivity reaction, like what? Like what, doctor? So, for example, if you are talking about eczema or hay fever, eczema or hay fever, or maybe some immunological disorders, of course, definitely hay fever or atopy, right? Or some immunological disorders, or maybe asthma. Those medical conditions are related to hypersensitivity reactions or allergies generally. So, if the letter is talking about any of that, so if the letter is coming mainly about hay fever, about asthma, should you include, doctor, the allergies? Yes, you must include the allergies, whether they are positive or negative. What do you mean, doctor, by positive or negative? So, if the patient, for example, is having allergy to dust, you must mention that. And if the patient is not having allergy to dust, you must mention that. Why, doctor, you must mention that? Because the medical condition generally is related to hypersensitivity reaction. So whether the patient is having allergy to dust, to smoke, to maybe cat hair or mites or whatever, you must mention that. And if the patient is not having allergy to any of them, you must mention that as well. So if the condition is related to hypersensitivity reaction generally, you must mention whether it's positive or negative. But what if, doctor, what if the patient or the medical condition is something not related to hypersensitivity reaction, like diabetes, like hypertension, like ischemic heart disease? Then you should stop and ask yourself whether this piece of information in the allergy is relevant or not. So if he is telling you something like the patient is having allergy to smoke or dust and he is having diabetes, do you think you need to include that? Of course not. But what if he says to you the patient is having allergy to short acting insulin and he is having diabetes? Should you mention that? Definitely yes, doctor. Definitely yes. Okay, again, doctors. So if the medical condition is related to allergic reaction or hypersensitivity reaction, generally, you must mention the allergy, whether it's positive or negative. So if the patient is having allergy to dust, smoke, mite, and he is having eczema, hay fever, asthma, you must mention that. And the opposite is true. If he is not having allergies to anything and his medical condition is mentioned one of those, you must mention this piece of information. It must be written. Okay? But what if the patient is having a medical condition which is not related to hypersensitivity or allergic reactions? Okay? Like maybe diabetes, hypertension, rheumatoid arthritis, gout, and so on. Then You must stop and ask yourself, is this piece of information or is this allergy related to the medical condition or not? Smoke, dust, mites are not related to diabetes or hypertension or ischemic heart disease. So if you mention that, you will lose marks because it will be irrelevant. But if the patient is having diabetes and he is telling you that he is having an allergy to short-acting insulin or rapid-acting insulin, you must mention it. If the patient is going to have a surgery and he tells you the patient is having an allergy to penicillin, do you need to mention it? Definitely yes, doctors. Definitely yes. Definitely. Why? Because in surgeries and the operation, the patient will be covered by antibiotics. So if you don't mention that the patient is allergic to penicillin, he may be given penicillin, which can be life-threatening. So in my own opinion, it's pass or fail if you don't try this piece of information. Allergy to penicillin and the patient is having an infection or the patient is going to undergo a surgery and you don't mention that he is having allergy to penicillin, the patient died. Take care, please, doctor. I hope that the point of allergies are crystal clear now because many doctors are find that confusing for them. They are find that difficult for them. So I hope that it's clear now when to include allergies and when not. So a very rapid summary. What did we take today? We have taken how to approach the case notes. And by the way, we haven't approached the full case notes. We will continue that in the next session. Inshallah, we have taken till before the main visits. So how to tackle the case notes? We started from the writing task and then the plan. We knew the specialist, the request, the diagnosis, and then we went to the first paper to include or to know the relevant, to know the irrelevant, the semi-relevant. We have known the family history as it can be relevant or not. We have known the medical history as it can be relevant or not, the special habits, the occupation, the allergies, when to include them and when not. Okay, this is the end of our session today, doctors.